Hi, everybody. This is Linzie Bugg, your friendly neighborhood nurse surveyor. Welcome to the Q's podcast, your trusted voice for nursing home insights, compliance tips, and forward-thinking solutions in LTC. Today, we are diving into something essential and often overlooked: mental health and well-being for older adults. Here's a powerful stat to get us started. More than 1 billion worldwide are age 60 and older. And by 2050, that number will more than double, exceeding 2 billion people. But with growth comes an urgent challenge. Many will experience mental health conditions like dementia, depression, anxiety, often alongside complex physical and social needs. Let's explore uplifting, person centered strategies that not only support residents' well being, but also align with CMS regulatory expectations. So, first, cognitive stimulation. Art, games, puzzles. Keeping the mind active is vital, especially for residents living with Alzheimer's and dementia. Think puzzles, card games, painting, drawing, even YouTube art tutorials. If they're fun and tech friendly, and they're also incredibly beneficial, easy to use. They boost memory, they slow that cognitive decline, and they ease anxiety and depression, sparking joy and social connection. I mean, it can spark a conversation between two people who had never even talked to each other in the nursing home, sitting there and painting or drawing or playing a game, whatever it might be, but it keeps their mind engaged. Conversation and reading is the next thing. Here's the truth: isolation fuels depression. So, we want to encourage chats between residents and start a book club or create a story circle. Audiobooks and video calls can also bridge gaps with family, keeping those precious connections alive and well. And minds stay stimulated and hearts stay full. So, you're kind of addressing both the mind and the heart. When they talk to their family and they have a connection, even though they're in this nursing home, they could see them every day if they wanted, which, not everybody has the luxury of doing. Just an easy, simple way to keep them engaged and also intact with their families. So the next is going to be hobbies and movement. Purpose plus health. From gardening to bird watching, baking to crafting, hobbies bring meaning to everyday life. So we want to encourage light exercise like chair yoga, walks, dancing in the hallway. If they can, if it's safe, allow them to do it. Just make sure that a medical provider is on board for safety. It's all about making that joy, providing movement, and helping them stay engaged. Now, what does CMS say? These wellness strategies align with key CMS tags, like we're going to go through a few of them here. So the first one is going to be F550. Resident rights and dignity are at the center of care. F550 protects each resident's rights to be treated with respect, dignity, and individuality, which absolutely includes their mental and emotional well being. So, F550 requires that residents are not dismissed, ignored, or patronized because of cognitive impairments, mood disorders, or mental health diagnosis. Their preferences, values, and choices, even when related to emotional support, social connection, or behavioral health needs, are honored and supported, as they should be. We want to create that culture of respect where staff understand mental health is just as important as physical health, because it is. So, next, F636 to F657 is comprehensive assessments and care planning. Facilities must gather timely and complete data on a resident's mood, behavior, cognition, depression, anxiety, psychosis, their trauma, substance use, and they have to discuss it with the IDT team and get their input and accurately capture in the MDS, which drives that development of the care plans. So you have to make sure that not only the IDT, but the family members are involved as well, because this care plan is basically telling you how to care for this person. It helps identify residents needing further evaluation, like a pass or referral. And residents with mental health needs must have individualized care plans reflecting their emotional triggers, coping mechanisms, and preferences. Non pharmacological interventions, such as talk therapy or structured routine, and updated when mental status changes occur, like worsening depression, behavioral changes. A resident showing signs of social withdrawal should trigger a psychosocial assessment and tailored interventions. They may need increased social contact, a different kind of therapy or therapist, or a new activity. They might just be getting bored. You have to reevaluate your residents. They're people. They're going to change as they get older, and that doesn't change once they're in the nursing home. You always have to be evaluating them. So next up is F699, which is trauma-informed care. So we want to ensure sensitive, supportive environments for trauma survivors, as traumas are a mental health issue. And many residents have experienced trauma such as abuse, neglect, exploitation, combat, loss, institutionalization, or severe medical experiences in their past. So facilities have to identify trauma histories and ensure that their staff are trained to recognize trauma-related symptoms. The impact of trauma can influence how a resident responds to care, how they interact with their medical environment, and transitions when it comes to being a part of their care. A resident with a history of sexual trauma might need female only caregivers, which is not abnormal. I don't know how many times I've been in a facility where that's happened, where I've had residents say, I don't really feel comfortable with males. I only want female. And a facility has not noted it on the care plan. And yes, they were tagged for that. Because if you have someone with a trauma history and they have asked for something, they have a preference, they've stated it, and you're still not following what's best for that resident, that can be considered abuse. And it absolutely is. They may also need clear verbal cues that are on the care plan that tell staff how to speak to them before physical care begins to make them feel more comfortable. Someone with PTSD may require a quiet, low stimulation environment and lots of reassurance during medical treatments. A resident should always be included in these decisions, as appropriate, because we know with cognition sometimes it can be a little different, but always remind them of their rights and give them time to express their fears and concerns, ensuring no further traumatization. So next is F740 to F743. So behavioral health services must match individual needs with the right staff, strategies, and documentation in place. So under these F tags, facilities must provide the right behavioral health services, ensuring emotional and psychological needs are assessed, documented, supported, and met by staff that are trained, responsive, and proactive, as they should be. It's really hard to mediate a situation once a resident has escalated so far that, they're just screaming or they're crying. If staff know how to de escalate them in those moments, they're going to do much better. Not only are they going to do much better, but the residents are going to be more easily calmed. And overall, it's going to help them. They're confused, okay? But they still need to understand where they are, and who they're with. And as long as your staff understand that, it's going to be fine. So the last F tag I want to talk about, or F tags, I guess, is F745 and F850. So social services are the bridge between medical care and mental wellness. They are vital to ensure that our residents feel heard, supported, connected, and emotionally safe, because mental health is a key part of quality of life. And under these F tags, a qualified social worker is essential to deliver meaningful, timely, and professional support for a resident's emotional and mental health needs. When it comes to social workers, some of them are social services and some are social workers. And we know with those F tags that over 120 beds, you're required to have a social worker with so much schooling and all that stuff. And it is important because when they have that many residents, they need to have that extra insight on how to not only organize, but understand a multitude of residents. Social services, the ones that don't have those specifications in the smaller buildings, they'll fare just fine. If they find that there's something that they can't address, I would hope that a social services designee would either ask for help or reach out to a social worker and ask questions, because that's how you make yourself better for these residents. And that's what we're trying to do. This is where QSource steps in. We offer customized planning, consultation on PASORs, support for dementia care, and implementation of trauma-informed practices. Consultation on PASORs, I want to clarify, the hospitals are taking over the PASORs, but we still need to make sure that that PASOR is supported and enforced when they're in the nursing home. It has to be on their care plan, what specific services are a part of that, and how they all are supposed to work together to make sure that the mental health needs are met during their care while they're in your facility, basically. QSource wants to help your teams not just meet, but exceed regulatory expectations, because every resident deserves more than care. They deserve enrichment and a higher quality of life. So, next time on the Q's podcast, we're exploring health and safety in nursing homes and how to help make the safest environment for staff and residents alike. Thanks for tuning in. Until next time, stay inspired, stay compliant, and keep leading the way in long term care.